Members of the Republican leadership in Washington, D.C. say the first order of business after President-elect Donald Trump is sworn in is to repeal the Affordable Care Act. And that has many people concerned about how that will play out. Will there be a replacement plan, and what would it look like? Whatever happens is sure to affect every Oklahoman, whether they have insurance or not. Throughout his campaign, President-elect Donald Trump vowed his administration would repeal the Affordable Care Act and replace it with something so much better. He maintained that the attractive pillars of the ACA would remain. But there are some who don't think he can deliver. Sylvia Matthews Burwell, President Barack Obama's Secretary of Health and Human Services, gave a dire warning this week, saying repealing Obamacare will result in chaos. Dr. David Kendrick is a department chair at the OUTU School of Community Medicine. While he doesn't have such a dire outlook, he does say many Oklahomans should be concerned.
If you're currently receiving coverage through the program, or you have a pre-existing condition, or you're under the 26 or younger and have your parents' insurance, you probably ought to start looking at you paying a lot of attention to the news and what's going on in Washington.
Kendrick says Congress could decide to demolish the insurance exchange and reverse Medicaid expansion to the states which accepted the federal dollars. Oklahoma did not, leaving thousands of Oklahomans working poor with no insurance. Kendrick hopes any substantial changes to the health care law will be rolled out slowly. Mike Rhodes is the Deputy Commissioner of Health Insurance for the Oklahoma Insurance Commission.
We believe at this point in time, from everything that we have heard, that 2017 is a safe year. It's a critical year and it's a pivotal year. But nevertheless, nobody is going to be kicked out of coverage in 2017.
Rhodes says there is a lot of work going on behind the scenes at both the state and federal levels to avert any dire consequences. As a regulator, Rhodes says he will be urging those working on changing the health care system to stabilize the insurance market in Oklahoma.
From year one of the implementation of the Affordable Care Act 2014, we had 5 carriers, lots of competition here in the state. But as the financial results began to diminish for several of these carriers, they dropped out.
He points out there is no longer insurance competition in Oklahoma for people who qualify for coverage under the ACA.
Toward the end of 2016 here, we find ourselves going into this new year, 2017, with only 1 carrier. We know that Blue Cross and Blue Shield of Oklahoma has sustained enormous losses, and it's driven by the utilization within their risk pool.
The risk to the insurer increased because Oklahomans are so unhealthy and because those who needed insurance the most got coverage. Susan Savage is the Chief Executive Officer of Morton Comprehensive Health Services, a community-based health care center serving those with no insurance or the underinsured.
Really and truly, the people impacted by the Affordable Care Act, those who will be hurt the worst if it's simply upended, are those who have the least.
She believes repealing Obamacare will only aggravate Oklahoma's unstable health market, which could drive up insurance costs for everyone. Rhodes says one change he has heard floated in regulatory discussions is changing the individual mandate.
Rather than make this a tax penalty for individuals that don't get insurance coverage, we turn that into an incentive, and that becomes a tax credit. Now, I don't know how that ultimately fleshes out, but I believe that part of your premium that you pay is probably going to be a tax credit or a tax deduction or something of that nature.
Craig Jones, who is president of the Oklahoma Hospital Association, says a lot of people in the health sector wonder how Medicaid dollars will be distributed if the ACA is repealed.
So there's a lot of discussion about whether or not the dollars will come in the form of block grants to states, whether they'll be administered by per capita caps. Those are the details that we just don't know. But the biggest question probably is going to be answered in January is what level of overall dollars that the ACA has represented will in fact Congress approve be distributed in one form or fashion to the states.
Jones says the American Hospital Association is compiling a report showing estimated financial impacts to states based on different scenarios. That information should be available to Oklahomans in a week to 10 days.